I'm a produce clerk. I work for a certain grocery store, and my job requires lifting up heavy boxes. I had been having chest pains for a few weeks. Went to go see my primary doctor, and then she referred for me to get an x-rays done. We couldn't find out exactly what was going on after those results came in. Weeks later, I still kept having chest pains. My left arm was getting numb, and the pain was a little bit worse. So she actually referred for me to get a cardio MRI done.
At first, it was when I started feeling like tired at my work, because out of the ordinary, I would just be like, I would walk in, I would do my normal activities throughout every day, and then I started to noticing that um, my health, my stamina, all started to go down. And then I was concerned. I'm like, why is this happening? Why am I feeling shortness out of breath all of a sudden? They did all these tests, but eventually they still couldn't pinpoint the exact problem of why everything was happening, why my heart was failing, why I had sleep apnea and all this. So they just came to the conclusion to get an MRI, and that way they would get a lot more information on how my body's working and what it could possibly be.
I had a burning right in my stomach here, and I couldn't figure out, it was not a pain that I had before. And so went to the hospital, and they did some tests on me there, and they couldn't figure out why. And it hurt so bad. Came up with this plan of first doing the echo on my heart, and then we did a CAT scan too. And it was still, we didn't get enough information from that.
I was feeling lightheaded and dizzy, and I had some falls, and I didn't have a reason for that. I went to a doctor and had a EKG, and I had an echocardiogram, and I got concerned because I have sarcoidosis, and it can affect your heart. I went to another cardiologist, did a lot of tests, even had a Holter monitor for a couple of weeks, and there was no answer. So my doctor recommended a cardiac MRI to be certain that I didn't have any cardiac involvement because of my autoimmune condition, sarcoidosis.
My daughter suffers from a heart ailment that they thought might be hereditary, and said this could be genetic, your family should have it checked out. And that was what sent me to the cardiologist for the first time. What they found was that I have an enlarged descending aorta, and that needs to be tracked because it can balloon and develop into an aneurysm, and those are very dangerous.
So as an MRI technologist, part of our job is to make the patient feel comfortable. A lot of times we have patients who come in and they feel anxious. They're not really certain about what's going to take place. And part of our role as a tech is to make them feel at ease, walk them through the questions and questionnaires that we have, and just make sure everything's going to be safe for them.
I still, like, I hadn't experienced it. It was my first time, so I still went like with a little anxiety, and because it's especially since I'm like a big guy, so I get anxiety with small spaces. So I thought maybe I am claustrophobic, but then once I got there, I did get nervous, but throughout the whole there, they made it comfortable. They even tested to see if I fit. I was fine. The techs were very friendly. They were accommodating and everything. They told me if I got any sort of like anxiety or if I didn't want to be there, they gave me a button. They're like, just press this button if you want to get out or if you need to get out for any sort of reason. Like, we don't mind. They made me feel really like pretty safe and like comfortable. So yeah, the techs there, they were perfect.
For cardiac MRI, there are a lot of breath hold sequences throughout the study. Patients will be asked to hold their breath on an average of 10 to 15 seconds per scan. And there are certain cases where patients just cannot hold their breath for that amount of time, and edits can be made by the technologist in most circumstances to lower that a bit. So we work with our patients to provide the best outcome for them while not giving up the quality of the image.
They gave me an option of which films I like to see in music, and they really made me feel comfortable with the blanket, putting pillows underneath my knee because I have back problems. And they told me if I start having back and neck problems, just let them know.
All MRI machines are equipped with a two-way communication system. So if a patient was to whisper or speak up louder, we pick up everything and can also communicate with them. We have a microphone where we can check in on them, and part of our training and process is to make sure that they know we're there with them, even though we're not right next to them. We like to make sure that we can hear each other. So if there is a need to communicate, we're right there. Throughout the entire study, these clicking and banging sounds will be going off, which is the reason that we provide hearing protection in all MRI scanners. That's actually required. And there are certain cases where patients are sensitive to noise, and we can double layer. We'll do in-ear and over-the-ear ear protection for their safety.
It's a very valuable diagnostic tool. I wouldn't know that I had an enlarged descending aorta, which is something that is important to keep an eye on. So I wouldn't hesitate to get one, just because the value is so great and the discomfort is so minimal.
This technology is there for you now. Don't be afraid of it. Relax. This is not something you should be afraid of at all.
You're going to be winning. You know, it's going to save your life. And I'm very grateful that I had done that, or else I wouldn't be here and my kids wouldn't have me. I have faith that you're going to come out winning in the end, and try to focus on something when you're in there, something positive, something that you could think about the whole time you're in there, so it makes it easier for you to come out, and less anxiety. And like I said at the end, it's going to be worth it because you're saving yourself. And you'll look at it back later, years later, saying that I'm glad I did it. That's what I said.